Psychotic delusions include the psychiatric conditions. It includes the delusion, hallucination, disorganized thoughts and behavior. Negative symptoms of the psychotic symptoms include the loss of abnormal emotion and behavior function. It includes the withdrawal, society withdrawal, emotional flat affect, loss of the emotion and behavior function. Psychotic disorders exist in the specific ranges of belief, stress-related episode, or chronic, such as schizophrenia. Positive symptoms of a psychotic include the delusion, hallucination, and delusion is the fixed false beliefs that resist to the evidence. It's false beliefs that are resistant to the evidence. It includes persecution delusion. Persecution delusion is the when somebody says somebody is after me or want to kill me. Grandiose delusion is when somebody says that they have a special power. Referral delusion is when somebody says that the referential delusion is when somebody says the television is sending me a message. Somatic delusion is when somebody thinks something wrong with their organs or inside their body. Aromatic delusion is when somebody thinks that they celebrity or somebody special is in love with them without them knowing. And mechanistic is delusion is my body no longer exists. So hallucination is the perception without the external stimuli. There is a different type of hallucination. Auditory hallucination is the most common and happens in the schizophrenia. People hear voices that command them, conversational and condition. There is a visual hallucination and is more common in substance use disorder. Disorders, delusional, neurological disorders. There is a tactile hallucination and it is example of sensation of insect crawling on the skin. There is an olfactory hallucination and that may suggest a temporal lobe pathology or temporal lobe is affected. Disorganized thinking is reflective through the speech abnormality like the loss of association, potentiality, the neurological word salad. So people who have dementia or Alzheimer's, that is the hallucination that happens to them. Negative symptoms include reflective loss of abnormal function, and that is the negative symptoms of psychosis. And negative symptoms of psychosis includes the flat affect. It includes the reduced speech. It includes lack of motivation. It includes loss of interest on pleasure. It includes the sadness. It includes the reduced social interaction. clinical importance is strongly associated with poor functional outcome. So the negative symptoms of schizophrenia or negative symptoms of psychosis is associated with strongly associated poor function of outcome, less responded to the antipsychiatric medication, and often mistaken for depression. Cognitive symptoms of a psychosis include poor work memory, and cognitive symptoms is mostly common in schizophrenia spectrum disorders, and it is poor working memory, impaired executive function, reduced attention, impaired social cognition, and cognition impairment is the major predictor of the disability. Major psychotic disorders include schizophrenia. Schizophrenia is required to be two or more of the following symptoms. It has to have two or more symptoms of the following symptoms, and these are delusion, hallucination, disorganized thought and speech, negative symptoms, colossal disorganized behavior. Functional decline of the psychotic disorders include significant impairment at work, relationships, self-care. Duration, it lasts at least 6 months to be schizophrenia, and it includes active symptoms, prolonged symptoms, residue symptoms. Schizophrenia informed disorders has a similar symptoms to the schizophrenia, but duration is 1 to 6 months. It's a brief psychotic disorder that lasts less than a month, often associated with severe stress, childbirth, and trauma, and complete return to a base function is expected because it's short term. Schizoaffective disorder, combination of schizophrenia symptoms plus mood episodes, and it requires major mood episode presenting with the schizophrenia symptoms that last 2 months of psychosis without the mood. Types include bipolar, which has the manic and depression. Depressive type, major depressive episode only. Delusion disorders present on one or more delusions. Duration is 1 month or less, 1 month or more. Functional is related by the perceived type of persecution, jealousy, aromatic, grandiose, somatic, fixed beliefs, hallucination are absent or minimum, neurological and pathological. Dopamine play a key role for the psychosis disorders. Increased dopamine is associated with the positive symptoms of psychosis, and negative symptoms is associated with decreased dopamine. Increased dopamine is especially happiness in the muscarinic pathway and has a dopamine increase that leads to hallucination and delusion. Decreased dopamine activity is associated with musculocortical pathway and releases decreased dopamine that leads to negative symptoms of psychosis and cognition impairment symptoms. Other neurotransmitter symptoms include glutamate dysfunction, NMDA receptors hyperfunction may contribute to the cognition impairment and negative symptoms and psychosis. Glutamate and evidence shows that the receptor NMDA agonist is ketamine can produce schizophrenia-like symptoms. Serotonin is important because a typical psychiatric affects the dopamine receptor, D2 receptor, and serotonin receptors. Risk factors include genetics factors, family, and is stronger predictor of family history is associated. General population is 1%. First degree relative is 10%. One identify a twin effect is the 50%. If your twin has the psychiatric psychosis and your twin has the schizophrenia, 50% of people who have a twin siblings who have the schizophrenia, they also develop the schizophrenia. People who have the first siblings, first degree relative siblings or father or mother, they have a 10% increase compared to other general population. There is environmental factors that affect psychosis and schizophrenia. Risk factors increase the preneural function, increases the psychosis, obstetric complication when the mother is pregnant, if she has a complication. When mother is pregnant, if she has a complication that increases the schizophrenia. Cannabis usage increases the schizophrenia symptoms. Childhood trauma increases the schizophrenia. Urban environment, which has a toxicity and trauma and drug or cannabis usage areas, it increases the schizophrenia. Migration or immigrant stress increases the schizophrenia. Differential diagnosis of a psychosis, you want to always rule out if there is a medical causes for the psychosis. You want to also rule out the metabolic, if there is a metabolic causes such as thyroid disease, electrolyte abnormality, vitamin deficiency, organic such as brain disorders like the dementia, brain tumor, seizure. Also vascular, you want to assess that for stroke. Endocrine, you want to assess the Cushing disease. You want to assess the high thyroid hormones. Substance usage, you want to assess the cannabis, cocaine, hallucinogenic, alcohol withdrawal, mood disorders with psychiatric features include depression, include bipolar. How you going to assess the psychosis? Psychiatric assessment is a comprehensive evaluation associated with the evaluation that you want to assess the onset of the psychosis, duration of the psychosis, trigger of psychosis, delusion of, if they have a delusion, if they have hallucination, cognitive change, insight or judgment change, safety, you want to assess the suicidal ideation, command, hallucination, violent risk, self-neglect. Functional status, you want to evaluate the employment relationship, activity of daily living, lab and medical workout. Common base evaluation, you want to do the complete blood count, you want to do comprehensive metabolic panel, thyroid, stimulated hormones, fasting, lipid panel, hemoglobin A1C, pregnancy tests, vitamin B12 assessment, folate assessment, urine toxicity screening. Additionally, you want to test it when indicated, brain imaging, electrolytes, infection screening, infection testing, autoimmune encephalitis evaluation,